Division Chief of Breast Imaging at NYU Winthrop Hospital. Today I'd like to discuss Entrustable Professional Activities in Breast Imaging Education, Trainee and Attending Toolkit. Let's get into the what, why, and how of Entrustable Professional Activities, also known as EPAs, specifically of breast imaging. What they are, why they're useful in training, and how they can be incorporated into our current educational models. So what is an EPA? It's a basic skill or task that is essential to the daily practice of breast imaging radiology. A group of researchers developed 5 breast imaging specific EPAs. These describe the basic skills and tasks that are core to the practice of breast imaging radiology, going from identifying abnormalities on screening exams all the way to performing localizations prior to surgery. For each EPA, a resource guide and worksheet was also developed. Each worksheet contains key functions. These are roles and functions that residents must perform to execute the EPA. Beside each key function, you'll see a small superscript. These superscripts refer to resources that are educational tools for the trainees to gain the information and knowledge that they need. These tools can be slides, journal articles, videos, or widgets, which are interactive PowerPoints. All of these have been curated by members of our research team. We've also mapped EPAs to competencies and subcompetencies and provided additional information regarding the knowledge, skills, attitudes, behaviors, and experiences needed to execute the EPA, as well as an assessment tool for attendings. But why should we use EPAs? EPAs are practical. They define the actual activities a competent physician must be able to perform in practice while also integrating our current competency-based training module. Additionally, the curated worksheets direct trainees to key resources to gain the skills and knowledge needed to develop expertise. But how can we incorporate EPAs into our current educational models? One way is by assigning specific EPAs based on the rotation which trainees are on. So if a trainee is on screening mammography, they can review EPA 1A and B, which covers screening mammography and screening ultrasound. If they're on diagnostic imaging, they can review EPA 2, which covers recalls and the workup of symptomatic patients, as well as EPA 4, which deals with the workup and management of patients with current and past breast cancer. On procedures, they can review EPA number 3, which deals with ultrasound, stereotactic, and MRI-guided biopsies, as well as EPA 5, which deals with pre-surgical localization. If they're on MRI, they can review EPA 1C, which covers screening MRI, as well as EPA 4, which covers the management and workup of patients with current and past breast cancer. So if you're still not sure, or if you're having a hard time grasping the concept of EPAs, check out the resources we've created on the RSNA.org website under the RSNA Trainee Resources, and go to additional resources to reach the EPAs. I'd also like to thank the RSNA Research and Education Foundation for funding this project. And a big thank you to everyone who helped create the EPAs. If you have any questions or comments, contact Monica Sheth at nyulangone.org or also send me a message on Twitter. Thank you for your time.